The use of AI by consumers in healthcare is the biggest, fastest change we've seen in hundreds of years in how people access healthcare. So, what I'm really interested in is not just what it means in the short term for consumers today, but what it's going to mean for our entire health system.
Welcome to the So What from BCG, the podcast that explores the big ideas shaping business, the economy, and society. I'm Georgie Frost. Millions are already using large language models to understand symptoms, interpret test results, explore treatment options, and decide whether to seek medical care at all. In many cases, they're turning to AI before they speak to a doctor. So if AI is becoming the first touch point in the healthcare journey, who is responsible for designing that experience, and how do we ensure it leads to better outcomes for patients? Joining me today is Ben Keneally, BCG's Asia Pacific leader for healthcare services. Ben, welcome to. Thank you so much for joining us. Ben, I'm going to start with telling you a little bit of a personal story, because when we last spoke, it was quite clear, I think, Ben, that I am a bit nervous about large language models being used. I think that's fair to say. My mother is a doctor, so that's my background. But since we last spoke a week ago, unfortunately, my partner got very unwell. And a large language model became my first touch point. And I understood really clearly how useful this could be to contextualize everything that was going on. Now, obviously, my concerns are still there, but I thought that that was quite an interesting perspective for me to understand how people are using these tools and how useful it could be. But just talk to me, if you would, not about me, but other people. How are they using it? How are they using these tools when it comes to accessing healthcare today, understanding all the things that I just mentioned?
No, that's right. And I think your experience is actually the paradigmatic experience today. And that is people are using large language models often to get assurance or to get an understanding of what step they should take next. So it's not a one and done step, but it is a step on a pathway to treatment and a step on a pathway to understanding.
Where are you seeing the highest levels of adoption, and what do you think that that tells us?
Yeah, so interestingly, we recently completed a global survey of where we looked at about 15 nations and spoke to thousands of people, all of whom were internet connected people. So obviously we're excluding the very poorest of the poor when we do that. But when we look at that, it is developing nations that are most advanced in their use of AI, large language models for accessing healthcare. And it's an interesting outcome. And it really points to the fact that in many developed countries, there are a range of free to access and widely available helplines or government sanctioned websites, or even just publicly available emergency departments, urgent care centres and general practice. But in developing countries, access to that sort of care is more constrained, sometimes more expensive for the people. And therefore, this sort of first step becomes even more important for people to really be able to tell, is this something that I should, risk spending money on, or is this something where I can care for myself?
It's interesting because my concern with using large language models was, are we going to almost get a two-tier system with those people that can afford to pay for a better sort of, I suppose, concierge service where, your notes are remembered, etc., and it can give you a better service. But actually what you're suggesting is that it may do the opposite.
In some ways, this democratizes health in a very true way. So within developed countries, it's actually the wealthier people who are using AI more. So rather than sort of splitting apart into, a physical upper tier service and a artificial lower tier service, it's actually people who have access and who are confident and have the literacy to use those services today are more likely to access. That said, one of the things that we are seeing emerging is that people who have language challenges, they're recent migrants to a country, for them the ability to then get their diagnosis translated or get their care advice translated into their languages, or the opportunity to just better understand what they've been told and to therefore comply better with their treatment recommendations and so on, is also a very prominent use case. And so in a way, it can improve access to healthcare for people who are excluded on the basis of their health literacy, for example.
Ben, we know that people are using these tools to check symptoms. But I suppose what comes next? What comes after that?
I mean, I think it's the transition from chat to agents is, I think, what's really interesting. So we're going to go from a world where, consumers are just, corresponding with large language models, checking their symptoms, understanding their diagnoses, etc., to a role where they have a health agent, an always-on health agent that not only can they, ask it questions, but they can connect it to their data, whether it's from their wearables or whether they're, granted permission to have access to their, results and their health records, etc., and can create a really sort of integrated, always-on health advisor that gives you advice about diet, about exercise, about sleep, about all those things that are actually, genuinely related to your underlying health conditions and circumstances. And then, potentially can move from there to make appointments for you, to, arrange healthcare checkups, to prompt you to get your immunizations, prompt you and make appointments for you to do things that are important for your health. I think that sort of always-on health advisor function is a really interesting one. And there's some really interesting questions about whether that's something which, in nationalized health systems is provided by that national health system, or is it something which is, a private sector, competitive choice, or, how do you regulate that? How do you manage it? How do you license and assure it? I think there's some challenging questions about how those agents will access private and confidential data, and what sort of security and confidentiality will be provided alongside that. But the future of AI is definitely agentic. And so I think that, the next step is how people's personal health agents, their personal doctor in their pocket, will start to evolve.
Where do you see the biggest opportunities here? Diagnosis, navigating healthcare, booking appointments?
I think this point about health literacy is actually the most important one. Mm-hmm. There's fantastic research that shows if people have access to their own healthcare records, to their electronic health record, to their, their written health records, and in particular, if they can combine that with contextual advice about their diagnoses, their treatment recommendations, their pathways, their options, then people are much more likely to firstly identify errors in their treatment path. So people reading their own records can see something's been recorded wrong here. They can raise that with their clinicians, and that gives them more likely to get onto a good treatment pathway. Secondly, they can understand what it is and what they need to do. And so we see much higher levels of compliance with treatment recommendations, consistency of taking medication, et cetera, if you have access to your own records. And thirdly, people are better able to understand what they should do if their symptoms change or worsen, et cetera. So the idea of being able to pair an LLM with access to your own health records can give you that contextual advice and that better understanding. And we know that that leads to, substantially better health outcomes, and in fact, more equitable health outcomes.
If we get this right, what do you think this will look like in years to come? The biggest opportunities, the biggest benefits, patients, providers, payers, everybody.
So I think, at the core, there's the opportunity here to really make progress on the sort of value-based healthcare agenda. And so moving away from, just measuring, we did these surgeries or we had these number of visits to doctors, to actually saying, have the health outcomes of the population as a whole been enhanced on the basis of what we've been doing? And, so how does AI contribute to that? Firstly, I think it allows a better understanding in the hands of everyone about what the known evidence-based pathways are. What's the modern best practice treatment pathway? Secondly, I think it helps with the collection and analysis of data. Now, it's good to collect all that data, but artificial intelligence, machine learning are incredibly powerful in helping interpret that and drive it. But then thirdly, you need to serve it up in ways that are actionable to people at the point in time when they need it. And I think, that starts to become more feasible and more possible with AI. So that helps payers because they're paying for stuff that works. It helps patients because they're only, they're getting the best treatment pathways. And it helps providers because I think it helps them focus again on what really matters. It helps take toil away from their work, the sort of gatekeeping exercises that a lot of doctors and nurses have to do just to manage processes and order tests and so on. There's a lot of administration that goes on. Again, a lot of that, they can be relieved of a lot of that activity.
Now, when we talk about AI and large language models, I just want to dig into this in a little bit more detail. Are we talking about the kind of big commercial players? I don't need to name them, we all know who they are. Or are we talking about, and I'll use the British example here of the NHS, building their own tools that we use instead?
I think it's a case of both and. So the large language models are an incredibly useful baseline resource for a lot of people, and they're easy to access, and they are a very good starting point. I think for the large sort of health systems, they're increasingly looking at, first question, how do I influence those large language models? How do I make my information, my best practice guidelines, my insights about population health, etc., available to those models so that they are more likely to pick up that information and serve it up to people? So there's a lot of large health systems are now looking at that. The second point they're doing, though, is then saying, how do we bring large language model capability behind the firewall of our system? What that allows them to do is to serve up to their patients, their citizens, the opportunity to inspect their own health record and understand it using large language models. It also gives them the opportunity to particularly train and weight the large language model so that it is providing advice that's relevant to that community, to the health system that's in that country, and to the population health challenges that that country faces. But it's both and, because what you want to do is have those people who are using the commercial models also getting great advice.
But of course, many listeners will be thinking about the risks, which I mentioned at the start. We've all seen examples where AI tools have provided inaccurate or even dangerous medical advice. How concerned should we be about that?
We need to be concerned generally about poor advice in the health system and dangerous advice in the health system. And it happens from humans just as much as it happens from technology. So the way, again, I like to think about it is as a both and kind of approach. That is, humans augmented by AI, you've got two ways of trapping error. One of the things we know is that on average, it takes 18 years to get best practice advice from the lab to the majority treatment pathway for patients in the real world. That delay is a delay that's natural and human. People go to university, they train, they go through development pathways in their careers, but they don't stay up to date with everything that's happening. And as a consequence, there is a translation gap from the best practice evidence that the researchers understand to what is actually practiced at the front line. AI can really help shorten that gap, can really help compress that gap.
What conversations need to be had among healthcare leaders, and how much of an issue, I suppose, is trust as well?
Two of the areas that we think are most important. The first is, as we were talking about, that access behind the firewall to AI so that people can, in a trusted way, allow AI to inspect their health records, to inspect their diagnoses and their test results and their treatment plans, and give them personalized advice and understanding that helps build their health literacy. The second thing that is being looked at and that people are very, I think, passionate about is how do we provide clinicians with the tools that help them do their work more face-to-face with their patients rather than looking at the screen and entering it? How do we help them with prompts and checks and additional support that doesn't impinge on their clinical discretion, but which helps them get their jobs done in a way that empowers the patient relationship that they have?
Your report argues healthcare organisations shouldn't try to stop this shift. They should try and help shape it. And I presume they already are. So what are you actually seeing? What examples have you got?
What we're seeing is people thinking about what is their consumer health experience of an AI augmented journey within their health system. So they're designing a tool, digital front doors that have AI embedded that allow consumers to access healthcare. So not just that first step of getting symptom advice and what's the next step and explain my diagnosis to me, but the whole pathway from I have a problem through to I've had an appointment made, I've received a referral, that the appointment with a specialist has also been made. Now my pathway to a surgical procedure has been set out and my preparation for it is AI enabled. And then my rehab afterwards is AI enabled.
What's the unlock? Or is it far more complex than that?
I think the unlock is leadership. So it's very easy to allow experiments to happen across a hospital, across a health system. Doctors and nurses are people who are interested in technology, and they get excited about it, and they will innovate at the front line, and that's fantastic. What you need is leadership saying, that's great, but I want to drive something else as well. I want to drive, these end-to-end processes. I want to organize around, an estimated date of discharge system for our hospital. I want to organize around a seamless pathway for consumers. Whatever it is, driving that from the top down as an end-to-end pathway requires leadership, because you've got to bring everybody on board. You've got to bring everyone together around how could we reimagine this whole journey. Point solution innovation doesn't need everyone on board. It's about unleashing individuals. Leadership's required to change a whole end-to-end process.
What kind of guardrails, governance, partnerships do you think need to be put in place to ensure that these tools genuinely improve outcomes rather than, I suppose, create new risks?
It's as much about how we make sure we maximize the opportunity as we manage the risks. To me, it would be a terrible shame if all we did was end up with just a tool that helped us check our symptoms and a tool that helped us understand our results. The opportunity here is so much bigger than that. There is a lot of, they call it waste. It's not that people aren't trying, but there's a lot of, in the end, health investment that happens in healthcare that doesn't end up influencing outcomes. There's a massive opportunity to use AI to make all of what we invest in healthcare work much more effectively towards better outcomes for humans. I do think there is a safety and a appropriate use sort of risk as well, and I don't want to belittle that, but I think the commercial providers have an incentive not to end up getting sued for providing bad advice. The regulators have an incentive for that also, for people to get good advice through their systems. I actually think we can work together pretty effectively to sort of manage and minimize that risk, give people the right advice when they need it. I think the stronger importance is about partnerships within and across our health system to make sure we're getting all of the opportunity out of AI.
If technology companies are increasingly owning that first interaction with patients, what does that mean for healthcare providers and payers? Who ultimately, I suppose, owns the patient relationship?
Yeah, and I think that is that's a critical strategic question. It's not even clear yet how consumer AI tools are going to be monetized in the future. I mean, is it going to stay just a subscription model, or is it going to move to something where there's an advertising revenue model in there, or at least in some LLMs, and there'll be a free version that's got advertising in it? Regardless, providers and payers need to think about how do they provide a great consumer experience? How do they make sure their brand, their reputation is well understood? How do they make sure that when an LLM is providing advice, it's picking up from their national health system or their provider or payer advice when people are seeking advice about who's a good payer that I should get an insurance relationship with?
To a certain extent, I suppose, with people living longer and all the sort of added issues that we're going to have with sort of, I suppose, economics, we're almost going to need something like this, aren't we?
I mean, everywhere you look, there's a story about shortages of doctors, shortages of nurses, projected forward, we'll never have enough, et cetera. And so, we have to find ways to deliver healthcare that scale that individual human relationship. I think the individual human relationship is just critical, and it can't be replaced. People, health is a human to human contact service, but there's a lot of what we require health workers to do that is not actually about that person to person relationship. It's administrative, it's process oriented, and so on. Think about people with a chronic disease. They often get put on a program of see your specialist every 3 months and we'll check in on how things are going. So I think there are a lot of opportunities to sort of change models of care that use AI to make the most of that human to human contact, rather than use it in a kind of very administrative or gatekeeping way.
So this is an AI plus clinicians, not AI versus clinicians, or AI even taking over all the jobs of our clinicians?
I do think AI can do jobs on behalf of clinicians, absolutely. But, supervised, there are a set of things where clinicians are simply applying a very simple algorithm to test results, to consumer, patient reported, symptoms or whatever. A lot of that we ought to be able to, make routine and automate, but that step of then really talking to someone about their needs and their aspirations and what they want to achieve, and then helping them, make choices and then feel cared for as well as just experience the care. I think all those things, still matter. And, I don't want to create a sort of a glorified ideal when the reality is around the world, millions of people aren't getting the basic healthcare that they need, and AI can be a big part of actually helping them get access to care as well.
Ben, thank you so much. And thank you for listening. If you'd like to read Ben's latest report, Consumers Are Ready for AI-Enabled Healthcare, Health Systems Need to Be Too, you can find the link in the show notes.